Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Pamela Buchanan. She's a physician, speaker, and thought leader. Today's Kevin MD article is Reviving the Emotional Flatline, Addressing Burnout in Healthcare Professionals. Pamela, welcome back to the show.
Thank you, Kevin. Thanks for having me on. I really appreciate it.
So tell us what this latest article is about for those who didn't get a chance to read it.
So this latest article is about what I call the emotional flatline. I talked about it in my TED talk because it was the analogy of what I felt when I was going through my episode of mental illness, like depression. I had suicidal. I'm a physician that work in the ER in a rural area in Missouri, just outside of St. Louis. And the pandemic hit especially hard. We had a lot of COVID deniers and we had a lack of resources because it's a rural area. And so, when you're a rural doctor, you're left to be all things, all people. I work there and I work in the city because the city's not that far. And it's easier to work in the city. And the stressors just kind of took a toll. It's just repetitive, unrelenting. People were reluctant to get help and weren't following the guidelines. And so we had some really massive outbreaks. I remember one we called the Red Wedding, where it was because there was a wedding that happened during COVID. And first, the bride of the mother got sick, and then the whole wedding party and the
Mm.
whole wedding. And then it just stressed our system to the bones. And a lot of our physicians felt ill. I never got sick, so I worked more than really a human should. I got depressed and I got suicidal, and it was odd for me because I've never been like that. I've never had that issue, and I didn't quite know how to deal with it. And so, I recall seeing a lot of more flat lines than I'm used to. And I was like, well, I feel like I'm going through like a mental flatline, and I felt like it was no worse than if your heart stopped. It was like my mind stopped, and I could go no further. And so that's really what I call the emotional flatline.
So when you talk about the emotional flatline, just tell us how other people perceive you. And then in terms of exactly emotionally, what are you feeling or not feeling during that time?
For me, and I think it's different for everyone else, but for me, I was feeling nothing. I felt, I'm normally a very empathetic physician, a very, engaged, and I just wasn't communicating as I normally should. It was quite insidious until I could diagnose it on anyone else, on a patient, on a colleague, but I really didn't recognize it in myself. I was withdrawing, didn't want to just think city caps, like we learned in medical school. That's what was going on with me.
Yeah. Now, at what point did you realize that it was a problem? Did someone come up to you and comment on it? So how did you eventually come to recognize it?
I would I was having this thought. So during the pandemic, I have about an hour commute to go to the ER that was rural, and I drive across this bridge. I kept driving across this bridge, and day after day after day, a voice would tell me, "Jump in," and
Mm.
I shrugged it off, and it was easy to listen to that voice because it was like the apocalypse during that time. Nobody was on the roads, only the essential workers, and so I had that thought repeatedly. I shrugged it off, and I overworked, and I kind of like tucked it away. And I wasn't seeing my family much either because we were quarantined. I have a son who has a chronic illness, so I was careful not to be around the family. I was in an area over the garage, so isolated too. And a colleague of mine, a mentor, someone I really respected, the nicest guy, get to work one day, he committed suicide.
Mm.
And so it's a shocker. And the whole ER is like, not him. How? Why? Beautiful family, active in his church, beautiful wife, kids. And so then I was like, if he could do that, then I need to get some help.
So what did you do next after recognizing these symptoms in yourself?
So first thing I did was I contacted the hospital's EAPs, see if they could help. They were no help.
All right.
And I got this from my colleagues because when you work in the ER, a lot of your friends are firefighters, policemen, paramedics. And within their system, mental health is embedded as one of their benefits. Like if we have a hard call where maybe something traumatic happens and you see maybe children die, someone burned, something that sticks with you, they are required to do counseling. It's embedded. They have it there. But the hospital didn't have that. And I was surprised. So then I would go down the back of my insurance card, try to call. This is a pandemic too, so
Mm.
nobody had any room. And then when I finally found someone, I thought, great, I can find somebody, but she didn't take my insurance. So I
Mm.
just paid out of pocket. And that's when I really realized that this whole mental health system is abysmal. And if it's that hard for me as a physician, it must be way harder for other people. And the only reason I was able to kind of figure it out is through connections. One of my best friend's husbands is a psychiatrist. He made some recommendations, and that was the way that it moved the needle for me. I kind of think, and I became passionate about helping people with this because I think if I weren't me, would I be here?
Mhm. Now, the pandemic was several years ago. Tell us the type of techniques that you're implementing to prevent yourself from falling into that emotional flatline state.
And so I started off with therapy, and that helped for a period of time. But then what helped me more than that was I found a coach and a physician coach. And the reason that helped me is because they got me. They understood, the day the day in and day out of a physician, because the day in and day out of a physician is unique. I don't think the generalized public gets how much self-sacrifice we have. So
Mhm.
physicians do a lot of self-sacrifice. You know how that goes. And it's ingrained in our brains from residency on. Like martyrdom is the way.
Mhm.
And so what I learned is that that is not something I have to be. I don't have to be all things to all people. It's possible to have a work-life balance. There's more than one way to be a doctor, and so I had to reconnect with my purpose. E- I love being a doctor, so why did I ever want to do it? What's my why? So went through a journey, reconnected with my purpose, and it helped me figure out how I wanted to practice and how much was enough for me, what I really needed, and tailor it to that.
Now, you mentioned earlier that some of our colleagues, like firefighters and paramedics, that wellness, that culture of behavioral health wellness is embedded in that culture, but not so much with medicine. Do you think that's changed over the last few years because we've brought some attention to that phenomenon of physician burnout and physician suicide? Have we moved that needle a little bit over the past few years, from what you've seen?
A tiny bit. So I'm an ambassador with the Lauren and Breen Foundation, and
Hmm.
its focus and mission is to help with prevent healthcare suicides, physicians and nurses. And so there's some legislation that's come through the pipes that has made it so hospitals are supposed to have physician wellness programs. Now, in theory, that's nice, and there's government money for it, but in practice, I'm not seeing it just yet. And that's why I think it's important for people like me to be vocal. I'm happy to partner with Northern Breen. I made friends with different people, some like Kim Downey. She's a physician
Hmm.
advocate, and I think it's got to be a grassroots movement. I don't think that the general public really understands the gravity of the situation because we're already at a shortage of physicians. It's been that way. I've heard that since I graduated. But then you have the pandemic and you have people who quit and you have people who want to quit. And then the average length of time of burnout is getting shorter and shorter. So we can't keep doing what we're doing or we'll be in crisis, like real crisis. And I don't want to see that. I don't want to be an older person not being able to find a physician. And that's one thing I'm afraid of. So I'm committed to working and I'm now coaching physicians to stay in practice because I think that we aren't given alternative ways to practice. Like there's just not one size fits all. And I think that needs to be made, um, something that is made available to physicians to consider.
Now, you mentioned Kim Downey. I actually just had her on the podcast right before you, and she's done wonderful work in terms of advocating for physician wellness. Now, you talk about a grassroots movement. How much of the responsibility, however, is needed from our healthcare leaders? Because a lot of the reasons why physicians are burned out, it's because of systemic causes, right? Top-down decisions. So tell us the responsibility that our physician leaders, our healthcare administrators need to have if we want to move that needle and improve physician burnout.
Well, I'd like to see us as physicians have more of a uniform and united mission of what we want and what we need, and clearly articulate that. And, I think that our leaders need to understand. I think our leaders think that money is the answer, that pay you more. And that is not the answer. I think they need to realize that we're humans. Like, for instance, I work in a particular ER that I work in because they treat me like a human. They consider me as a whole person, ask questions about what I need, what schedule benefits me, and involves me in the process. They do that for all of us. Example being this holiday season. I didn't work most of the holidays because I have colleagues who are on shift who are Muslim and they didn't want to be off for the holidays, but they like to be off for other things, their holidays, such as Ramadan, and I'm happy to work it. So we have more humanity. I think that's what it's going to take. And I think our leaders need to realize that we're not wrote things that do a service like assembly line, but we are humans handling other humans. And in order for us to do a good job, and we need to do a good job because we need to be alert and empathetic. You can't be robotic in delivering bad news. We need to be rested and well and not sick.
So, just to clarify what you said, you're seeing stories where healthcare administrators see the problem of physician burnout and think a solution would be just simply to pay them more and throw money at the problem. You're seeing that commonly, either personally or through your colleagues?
I see that a lot, very much so personally. ER, where I used to work, raised their hourly rate there so much that it seems unreal. But I'm like, the answer is not that. The answer is don't use me like a workhorse. I recall working a shift and then someone not being able to show up and working 24 hours straight. And it reminded me of residency, and I'm attending. That's not what I want to do in my life. That's not how I want to feel. And so, yeah, money is not the answer. When you have enough, you have enough. We
Mhm.
all want our basic needs met, and there are even studies that there's a certain amount that's enough, and I think it was somewhere around 70,000. Doctors do better than that, but for me, I don't need to work until I'm sick for just a large sum of money.
So you talked earlier about physicians need to unite and create that grassroots movement. So for those doctors who are listening to you now or seen your TED Talk or read your articles on KevinMD, how can they rise up and join such a movement?
You know what? I think ask for what you need because I think the tides change where I work because more people were vocal about this is what I need. And I can't continue. I mean, just really at our wits end, I can't continue on if I can't get some concessions. And I think some of us were or are afraid. I think it's the perfect time to be more vocal because it's not an easy task to make a physician. It's not something all of us can't quit and be tragic.
Mhm.
And so I think our administrators are at a point where they have to listen, particularly in places where it's sparse, like in rural communities. It's already difficult even before the pandemic to get someone to work there. And then after and I really feel for people in rural communities because you see hospitals closing left and right, OBGYNs are leaving left and right. They need us. And so I think that administrators have to realize that. And if you're an administrator and you don't realize that, I really think you need to do it before it becomes that emergency,
Mhm.
that tragic event. We have nobody here. We need somebody. What do we do? So that's where we are.
We're talking to Pamela Buchanan. She is a physician, speaker, and thought leader. Today's Kevin MD article is Reviving the Emotional Flatline, Addressing Burnout in Healthcare Professionals. Pamela, as always, let's end with some take home messages that you want to share with the Kevin MD audience.
I just want to encourage all of our physicians and medical students that if you're experiencing an emotional flatline, if you feel like you're at your wit's end, you know that there are resources. I mean, you could go online, on the Breathe Foundation, and you can look me up. I'm happy to coach and work with people. And in addition, you call 988. They always there for you to talk. So I don't want anyone to go through that situation and be at their wit's end and end tragically.
Pamela, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you, Kevin. Have a good one.